Hi, my name's Steve. Thanks for visiting my website. So this is just a short video to allow me to explain to you a little bit about how I've got to where I am at the moment and what's likely to happen if you do choose to come and see me. I started growing herbs when I was about 12. My mother was a homeopath, and so I was brought up with complementary medicine as a choice from my parents. At the age of 17, I started to go to the School of Herbal Medicine in Tunbridge Wells, where I was taught Western herbal medicine. This involved being taught subjects such as anatomy, physiology, pathology, biochemistry, histology, pharmacology, gynecology, nutrition, etc., etc. I joined the National Institute of Medical Herbalists, the oldest body of herbalists in the Western world, being founded in 1864 in 1985, and I started to practice from then on. So I initially started practicing in Highgate in North London and in Suffolk. After a number of years of practice, by the late 80s, I became interested in Chinese herbal medicine. I studied Chinese herbal medicine for a couple of years in this country and then went over to China, Guangzhou in fact, or Canton as some people in this country know it, and worked in hospital there, gaining invaluable clinical experience. Traditional Chinese medicine is a theoretical subject which dates itself back to a book called The Yellow Emperor's Canon of Internal Medicine. This was compiled around about 100 BC. So therefore, for the last 2,000 years, Chinese medicine has been used in a continued fashion. The way you diagnose is you look, you hear, you ask, and you feel. You look at the person, you look at their tongue, you ask questions, you hear the answers, you hear body sounds like coughs, and you feel the person's pulse. If you can do this, you can arrive at a diagnosis. If you can arrive at a diagnosis, you can then treat. Realising that I liked Chinese medicine as a theoretical subject so much, which was very natural, so therefore when you feel cold, you contract, when you feel hot, you tend to expand, and such obvious observations of the human condition as that, I therefore realised that as I was interested so much in the subject, I would need to really learn acupuncture as well. So therefore in 1993, I went back to China and learned acupuncture in the same university hospital. I then returned in 1995 and did advanced herbal medicine and acupuncture in the Chinese Medicine University Hospital in Guangzhou. After that, I then worked for the National Health Service in the mid-1990s at a place called the Gateway Clinic in Clapham North with a guy called John Tyndall, who was the originator of the clinic. Generally, working for the NHS for 2.5 days, I was guaranteed to at least 75 patients for body acupuncture and herbs, and a variable number for ear acupuncture as we held a detoxification drop-in service at the clinic. Subsequent to that, I then moved to central London and worked in Soho and was head of complementary medicine for the Third Space Medicine. In that time, I've also been past president, or I was past president of the National Institute of Medical Herbalists, and I was also proud to be named by the Daily Telegraph as one of the top 20 health gurus in the country. So, I have a master's degree in herbal medicine, and therefore the dissertation that I wrote was on irritable bowel syndrome. So therefore, I have an interest in treating digestive problems, which I find that herbal medicine and acupuncture work very effectively for. Also, obviously, with my background for the NHS, certain immune conditions such as HIV/AIDS and hepatitis C were an interest certainly then and still are to the current time. Herbal medicine and Chinese medicine generally is very good for any kind of condition that you might care to go and see a general practitioner for. So whether it's anything from a transient sore throat and a cough and a cold through to chest infections or digestive upsets or skin conditions, Chinese medicine, herbal medicine and acupuncture work very, very effectively. I practice in a holistic fashion, so therefore I would ask you to be aware of your diet and to adopt as healthy a lifestyle as is realistically possible. So this will mean for a couple of weeks I might ask you not to eat certain foods. This may be seen as a bit of a chore. However, it does mean that the medication and the treatment tends to work more effectively. And the second reason is that it allows you to see whether or not certain foods might be aggravating how you feel. And then, of course, you can decide what you do about it. Generally speaking, as an approximate rule of thumb, I tend to say to people that for every year that you've had a condition, it may take 1 month of treatment to rectify the situation. Now, as I said, this is holistic treatment, so if you can eat the right food, if you do sensible physical exercise and do abdominal breathing techniques. So therefore, realistically, anything you feel like going to a general practitioner about is probably going to be inside my remit of experience and my ability to help you to make yourself better. So therefore, in a consultation, you're usually with me for around about 1 hour on the initial consultation. In this time, I'll go through and take your full case history as well, doing a few basic tests. So I'll obviously look at your tongue, feel your pulse, check your blood pressure, and go through and take a variety of questions that would be similar to seeing a Western medicine practitioner. At the end of that time, if you choose, you can have acupuncture as well, which is included in the fee. Herbal medicine is also available and obviously recommended. Herbal medicine costs from me £10 per week for 100 ml of tincture, and I also use dried Chinese powders depending on the circumstance. If you have any other kind of questions or want more information, then there is a link on my website for a form that you can send in to me. My mobile number is also on my website. Please don't hesitate to contact me. And also, the final thing, I do offer free 15-minute chats if you just want to come in, meet me, see what I'm like, see what's going on, and then we can discuss whether or not I should be able to help you. Okay, thank you so much for your time. Goodbye.